In this video, we're going to show you how to have the system automatically create an encounter for you when you check the patient in. When you look on the calendar, you can see that there are three sections to the appointment. There's the time side, the status, which is in the center, and the patient's name. If you click on the patient's name, it will take you into the patient's chart. So what we're going to do now is we're going to create a new appointment, because right now it is now 5:20 p.m. in my time, so I'm going to set the appointment for 5:45. And then we're going to go ahead and select one of our test patients. And let's do number 5. And whatever we put in this box here, will actually show up on the calendar as well. So let's go ahead and save this appointment. Now, the system will tell you that, hey, I can't determine that this is an open slot for this provider, and that's because the calendar is not set up properly. Once the calendar is set up properly, then it can calculate if there is a date and time, this particular date and time is open for this provider. At this point, you can go ahead and just click OK. It will create the appointment. And as you can see, we have an appointment for this patient at 5:45, and it says what we put in the comment. Now, when you're ready to check the patient and the patient has arrived, they're sitting in the lobby waiting for to see the doctor or to see staff members, go ahead and click the time side again, and now you want to change the appointment status to arrived. Once you change the appointment status to arrive, you can go ahead and save the appointment. It's going to tell you again because every time it's going to check to see if the slot is open, and it's not, but you can go ahead and click OK. Then it's going to tell you that it's created a new encounter, and it's going to give you the encounter number. Now, when you go ahead and click OK, as you can see, now this symbol has changed from a dash to an @, and if I click on the patient side, or the patient name, it's going to take me into the patient's chart. And it'll pop up the clinical reminders. Click OK. Now when I click on Visit History, you can see now that I have a form here that says Smashed Hammer. If I click on it, it takes me into the encounter or visit, and now I can start filling out documentation for this visit. If I need to take the vital signs for the patients, I can simply click Vitals, and it will populate, and I can fill out whatever vitals we need for that particular patient at that time, or any one of the other documents that need to be filled out for this particular visit. Once the documents are filled out, they will show in the patient ledger here. And just to simulate something being put in the chart, I'm just going to grab some text from over here and slap that in there. And then go ahead and save that. As you can see now, I can see that there's been a speech dictation form filled out for this patient for this particular visit. And that's how you would document a patient's visit to the clinic.